I'd now like to welcome our first guest on the program, Michael Romanzo, Chief Strategy Officer with RxBenefits. Michael, good morning.
Good morning. How are you today?
Great. Good to have you on the program. You coming to us from Birmingham today?
Actually, I'm in Atlanta, but RxBenefits corporate headquarters is in Birmingham.
We should have had you in studio today, Michael. We're up here in Alpharetta.
I'm not far in East Cobb.
Yeah, there you go. That's where I raised my family in East Cobb. Well, Michael, nice to have you here. You guys are doing some really interesting work. Give our audience a background on RxBenefits, please.
Sure, I'd be glad to. RxBenefits is a pharmacy services and administration company. It's 20 years young, located in Birmingham, Alabama. And we essentially offer 4 lines of business to the marketplace. The first line of business is our pharmacy administration business, where we provide pharmacy benefit services directly to self-insured employers in the small to mid-market space, groups of about 1,000 employees and smaller who want to carve out their pharmacy benefit that are self-insured. We have over 300 clients located throughout the country and essentially have members in all 50 states. Our second line of business is our pharmacy consulting business, and that's where we actually do procurement for pharmacy benefits for larger employers who choose to go the route of contracting directly with one of the 3 big PBM firms. And in that instance, we will conduct an RFP, and in most cases, our clients retain us for ongoing consulting during the life of the PBM contract. Our third line of business is pharmacy auditing, where we actually audit pharmacy contracts to make sure that employers receive the economics that were promised in the pharmacy contract. And then the last line of business is our health services segment business, where we provide access to our employers and their brokers and consultants to health-related products. We have a diabetes monitoring program that uses a cellular chip in a blood glucose monitor. And while that in and of itself is not revolutionary, what makes this program unique is that there's a back-end intervention center. And so when a member records their blood sugar, should they have an inappropriate reading, either too high or too low, we have an intervention center that contacts the member and intervenes to try to mitigate the unusual blood read. So a broad range of services in the marketplace. We seem to be extremely successful in targeting the smaller and mid-market self-insured employers, and it's been a fun ride.
Hey, Michael, do you primarily focused on the self-insured market? Is that your niche?
That's correct.
Okay, that's great.
Mike, it's Ron Bachman here. Can you tell us about Smart Pharmacy Economics, one of the services that you provide?
Absolutely. So pharmacy economics, or smart pharmacy economics, is a phrase that we've coined to really put a little different spin on the dollars that are spent to treat patients using drugs. So let me give you a reference point. In today's world, in a self-insured employer's world, half the people use 96% of the dollars in pharmacy spend. And those people have chronic or complex conditions. And so essentially when someone has a chronic or complex condition, they'll go to the physician. 88% of the time, the doctor will write up 1 or more prescriptions to treat or manage that condition. Mm-hmm. And so while we want to make sure that the cost of those medications are affordable both to the patient and to the employer who's paying the majority share, we also want to ensure that we have the right drug and the right dose to the right patient at the right time, and that we then also take advantage of treatment versus cure so that we can create value propositions around disease states such as hepatitis C, which up until recently was only treatable, but now in 95% of the cases it's actually curable. So in some instances, smart pharmacy economics means making patients that are that have chronic and complex diseases more adherent to their essential medications. And in some cases, it's creating a better ROI, a better return on investment, when you spend dollars in pharmacy, but you cure a disease like hepatitis C, and you save downstream medical costs on the medical side.
Does smart pharmacy economics also help both employers and their employees make better decisions around not just adherence and the right drug choices, but maybe cost-effective alternatives to some of the higher-priced, drugs?
Yeah, that's an excellent follow-up question, and absolutely, smart economics really impacts the physician and the prescribing patterns that they use, the members and the drug products that they purchase at the counter, and how they go about purchasing it, and then the employer who builds what we call rule sets around the prescription benefits to help drive and channel members to use the most cost-effective drugs. So part of smart pharmacy economics is to have a formulary. And a formulary is a list of preferred drugs that once a doctor deems a patient requires drug therapy for a particular condition, we then direct them to write a prescription from a drug formulary, which is heavily populated first with generic drugs, and then secondly with drugs that are brand drugs that are most efficacious and also cost-effective. Secondly, we build programs around step therapy so that we try to encourage the use of generics first before patients, go immediately to the more egregious brand drugs. And then lastly, we use technology. So member websites, consumer websites like GoodRx and MedTipster and others to help make members better consumers by getting them to go to those drugstores that sell drugs cheaper than others.
Michael, on your pharmacy consulting, sounds like you'll take the role of going out and looking for the right PBM and doing some pricing and negotiating for employers. Is that correct?
That's correct. We have a proprietary library of several hundred questions that we can tailor a qualitative RFP on behalf of an employer. We tailor that RFP very specific to the employer's pharmacy program objectives on things that matter most. We then have a second section that's our mandatory business requirements, which include many requirements around the financial offering that must be met, terms and conditions that are favorable to the employer. And then once we have whittled the marketplace down to 2 or 3 potential vendors, we then bring them in for oral presentation so that an employer can meet and greet the folks that they will potentially do business with. We help them through that entire process, including memorializing a decision point that they can then share with the C-suite executives and then negotiate final terms and conditions with the PBM. And then we stick around during the life of that contract to make sure that those terms and conditions, in fact, hold true.
What's the biggest value added for employers? It's a very confusing area, the whole area of pricing and contracting and rebates and all that kind of stuff that goes on in the pharmacy area. I mean, it's 20-25% of their healthcare spend, and yet it's very confusing for employers to understand what's really going on. What's some of the biggest confusions that employers have that your service helps to clear up, and what are some of the biggest value adds that you make in doing that consulting work?
Sure. So pharmacy is very complex, and part of it is the nature of the industry and the nomenclature that's used. But the second reason why it's complex is because many employers lack in-depth experience in-house. They don't have a staff of pharmacists or clinicians that will help them navigate through this complex benefit. So when we consult, we make sure that we break things down into simplistic terms on behalf of an employer So while the pricing of the pharmaceutical products are discounts off of average wholesale prices, and brands are different than generics, and generics are different than specialty, and then you have channel management between mail order and retail, we tend to reduce things down to an average script price that allows an employer to have a relative value, a very simple value, that they can relate to both historically and then on a prospective basis. The second thing that we do is we help define terms and conditions. Believe it or not, everyone thinks that a generic drug is a generic drug, but when you read a pharmacy contract, there are certain pharmacy contracts that try to exclude certain generic drugs from consideration. Generally, those generic drugs that are new to market or that behave from a price standpoint more like a brand drug and aren't discounted nearly as much. The third thing we do is we make sure that we have complete transparency into the pharma rebates that an employer can earn as a cost offset on behalf of their employee population. And then we give the employer an option on how those pharma rebates can be applied, either as a cost reduction to the drug spend or to a price reduction to the overall prescription, so that the member also gains value as well. So essentially what we try to do is create simplicity around the complexness of pharmacy. We try to isolate the areas that we know that are less valuable and make them and clarify them to make them more valuable. And at the end of the day, our job is to create a contract that is auditable, that's transparent, and that the employer understands how they actually purchase pharma.
Michael, with more employers asking their employees and families to take shared responsibility in their healthcare costs and healthcare decisions, including pharma, do you help employers in their educational and communication efforts with their employees?
We absolutely do. So we have a team of marketing experts that are a resource for us and our employers. We have sample communications that we help employers write as they communicate the benefit changes and benefit designs to their employees. We also work directly with the PBMs when we're consulting to make sure that we're leveraging all of the tools and capabilities, whether it's website technology or refill reminders or any other programs that are designed to improve the member engagement and the member experience in pharmacy so that the member becomes more of an owner of the program. We've seen recently, a huge shift to high deductible programs, and that applies to pharmacy as well. And those are really financial models, not so much a clinical model. And so we want to make sure that if an employer is offering that type of program to their employees, that the employees have a knowledge domain on how to best become a better consumer. So how to shop for a drug if they're paying 100%, what pharmacy perhaps is offering a better price at 100% copay for certain drugs, how to take advantage of the $4 or $10 generic drug offerings that some of the big box pharmacies offer. And so we've packaged a lot of those kinds of communications and also help employers create incentives to help drive utilization of the lowest cost, pharmacy pharmaceuticals for the members. So it's a very comprehensive strategy.
Michael, we're at the end of our segment and really have enjoyed having you. I want to give you a chance to kind of recap and leave our audience with a few takeaways, please.
Well, I appreciate that. First, thank you for having me. I would like to just leave everyone with the following comments. Number one, pharmacy is complex, and don't be afraid to understand that it is complex and use professional resources to help you become a better purchaser of pharmacy. Number two, employers in particular have a choice. They can buy pharmacy either through their health plan in a carved-in arrangement, or they can buy it on a carved-out arrangement. We've seen historically the economics work better for a self-insured employer if they buy direct rather than through a carved-in program. And then lastly, recognize that while we think about the spend of pharmacy and the use of pharmaceuticals as a line item expenditure, we really should be thinking about pharmacy in terms of return on investment. And if we can use a pharmaceutical agent to cure a disease like hepatitis C, while we incur some big upfront expenses, we in fact are making our population healthier, and we are reducing downstream medical costs.
Michael, how can our audience get in touch with you?
They can reach me at RxBenefits, which we have our website, RxBenefits.com. They can also reach me at M. Romanzo, that's Romanzo, my first letter, my first initial M, at RxBenefits.com.
Michael, thank you so much. And, we'd like to have you join us here coming up at IHC Forum and Expo here in Atlanta, May 24th through 26th. But thank you very much for joining us today, and have a great weekend.
Glad to be with you, and same to you. Thank you.